Karibu sana. This is MBCI TV ambapo tunabadilisha maisha by the grace of God, and today's show is Afya Clinic, where we talk about everything health, and your host for today will be Rachel Kahugo. Today we are having a guest who is a very important guest. As I had said before, he is Dr. Emmanuel Wekesa, and Dr. Wekesa is one of the best doctors, gynecologists, not only in Nakuru but in Kenya. So we've told you, if you have any question about fibroids, please feel free. Our numbers are very open. That is 0721 105 105 on WhatsApp, 23814, our SMS code, which is absolutely free of charge. But of course, we're live on Facebook on MBCI TV Facebook page. We're live on YouTube on MBCI TV official YouTube page. Now, just before we introduce our doctor today, we had said that you text in so that we know how you're doing. I'll just read two messages and then we'll be getting into the topic of discussion today. All right. Anasema, hello Rachel, hello. Anasema, I'm watching from Imara Daima. I'm grateful for life and the grace of God that he has carried us through January. Anasema, MBC, you're doing a good job. Stay blessed. Asante sana, stay blessed as well. Okay. I'm having so many questions as a fibroids. Don't worry. We are coming there. We are coming there. Okay. Anasema, hi, good morning and praise the Lord. Good morning and amen. Anasema, I'm Chachil Keith, watching from Milimani Nakuru. I thank God for new opportunities of open doors. I trust him for a job. You know, I've seen this message and I was just grateful to God. And I'm so happy that you've actually texted, because you're saying that you are thanking God for new opportunities and open doors, yet you are trusting him for a job. You know, most of the times as humans, when we're trusting God for something, we focus for, ujanipea bado. We are trusting you, God, for this. But you don't realize that he's already blessed us so much. So it's such a good thing that you are already in the mood of thanksgiving as much as you're trusting him for something. And I hope that will be our attitude the whole of 2025. Tulianza vizuri 2025. Tukasema January is where we already start working on our resolutions, but also just thank God for the fact that you've come. So I'm really grateful, and I pray that Churchill, God will answer your prayers in Jesus' name. Amen. Now, I had promised I'll just read two questions, two messages, so that we'd get into the topic of discussion today. Now, that said and done, let's get the In History segment so that we know what you're talking about today. And then thereafter, we'll be having the guest profile to know who we are having today. For now, let's get the guest, the In History segment about fibroids.
Uterine fibroids, having a rich historical background, dates back to ancient times, where archaeological findings have discovered calcified fibroids in prehistoric caves and Egyptian mummies, demonstrating their long-standing presence in human history. In ancient Greece, Hippocrates 460 to 370 BC first referred to these uterine lesions as womb stones, while Galen in the 2nd century AD characterized them as scleromas. The medical understanding and treatment of uterine fibroids evolved significantly in the 19th century. The first laparotomy related to a uterine fibroid was first performed in 1809 by Surgeon Ephraim McDowell on Mrs. Jane Todd Crawford, a cousin of President Abraham Lincoln. A major milestone occurred in 1840 when Amersat performed the first successful myomectomy, initially misdiagnosing the fibroid as an ovarian tumor. By 1898, Alexander Adam presented 11 cases of myomectomy through an abnormal route, though his approach was initially met with skepticism from medical professionals who preferred hysterectomy. Today, uterine fibroids are recognized as the most common pelvic tumors among women of reproductive age, affecting more than 70% of women worldwide. They are particularly prevalent among women of color, with significant variations in prevalence across different age groups. For instance, 60% of African American women aged 35 to 49 and 80% of those over 50 report uterine fibroids, compared to 40 and 70% of women in the same age ranges. Despite their benign nature, uterine fibroids represent a substantial health challenge, with annual USA healthcare costs estimated at approximately $34 billion.
So that is it about the In History segment about fibroids. So I hope that you've been able to understand the history of fibroids. Now, we've told you before that this topic today will be handling it with a gynecologist, and his name is Dr. Wekesa. Now, for you to understand more about him, let's get the guest profile, and then you get right into the discussion.
Today, we have the honor of hosting an exemptional guest, Dr. Emmanuel Wekesa. Dr. Wekesa is an esteemed obstetrician and gynecologist currently serving at Level 5 Hospital in Nakuru. He is also the lead obstetrician gynecologist at Preston Medical Center, Nakuru. With not just training, but a true passion for his work, Dr. Wekesa is a well-informed expert on gynecological issues, making him one of the most sought-after specialists not just in Nakuru, but across Kenya. Get ready for an engaging conversation as we explore key topics in obstetrics and gynecology with a doctor whose dedication and expertise shine in everything he does. Let's dive into today's discussion with Dr. Wekesa right here on Afya Clinic.
Perfect. And we are now here to tackle all your questions. I'll repeat our numbers. That is 0721 105 105 on WhatsApp, 23814 our SMS code, which is absolutely free of charge. And by the way, on our WhatsApp number, you can still SMS. We'll get your message loud and clear. We're live on Facebook on MBCI TV Facebook page. We're live on YouTube on MBCI TV official YouTube page. Ukienda pale, you text in, we'll be able to get your comment, and the doctor will be able to answer. We hope and pray that we'll be able to answer all your questions, because already we have very many questions coming in. Daktari, karibu sana.
Asante sana.
How are you?
I'm okay.
It's been a minute. Happy New Year.
It has been a while. Happy New Year. Happy New Year.
The last time we had this show, it was on Raushwa, not Afya Clinic, right?
Yeah, sure. Awesome.
Okay. Sawa sawa, karibu sana.
Asante.
We're really glad to be tackling this particular topic, fibroids,
Yes.
where we've had so many people asking about fibroids and saying that they'd want a doctor. So we thought, because they've asked, today is the right day to actually do it.
Sure.
So karibu sana, we're really honored.
Asante.
Please say hi to the people. That's your camera, and then you can start.
Hi viewers, welcome to today's topic. I hope we are going to have a nice discussion as you get informed about the topic of the day. Karibuni sana.
Perfect. So let's just start from the very beginning for those who really probably don't even know about fibroids.
Yes.
So in layman's language, fibroids ni nini?
Fibroids, basically the tumors of the uterus. So the uterus has the thickness of the uterus has 3 layers. So fibroids are actually growths that arise from the muscles of the uterus.
Okay.
It's good to mention that fibroids are not cancer. They are growths, yes, but they are not cancer.
Okay.
So these ones, they grow on the womb of a woman, and usually a woman of reproductive age.
Okay.
We don't see them in people who have not reached adolescent yet. So we see among women of reproductive age.
Okay.
Yes.
Okay. What is the cause of these fibroids?
So the cause of fibroids are thought to be related to the hormones. The hormones that are more in women, like estrogen especially, but also progesterone. Those ones are thought to contribute to the growth of fibroids. However, the exact cause might not be well defined, but we know they're related to the hormones that are higher in women, that is estrogen and also progesterone.
Okay.
However, we have things we call risk factors that put someone at risk of getting fibroids. For example, if you have never given birth, for a woman who has not given birth for a while, such a woman is likely to get fibroids.
Okay.
So if you stay for long without ever getting pregnant, you are at risk of fibroids.
Okay.
Also,
what is this a while? How is it defined? Is it
it's
certain
not,
number of years?
It's not like defined. There's no cutoff. But the longer you stay without ever getting pregnant as a woman, they're more likely to get fibroids. Okay. For example, if someone is, let's say, someone who is 35, 40, and they have never given birth, they're more likely to be found with fibroids than someone who is 35, 40 with, say, 6 children or 5 children, for example.
Okay, I see.
Yeah.
So there's that, a woman who not be given birth for a long time.
Yes.
Are there other risk factors?
Yes, the other risk factors include maybe family history of fibroids. Things like high BMI, the body metabolic index, that one has also been associated with fibroids.
Okay.
Yeah, so we have such kind of factors as well.
Okay.
Yeah.
Now, high BMI.
Yes.
How is that related with fibroids?
It's all about the hormones that are related to your BMI.
Okay.
Yes.
Okay, I see. Now, you've talked about hormones generally
Yes.
being the cause of fibroids.
Yes.
And as you know, every lady has the
the
hormones
hormones.
generally. So as
Yes.
a lady, are there some of the things you're supposed to do that would be the cut-off of, ukifanya hivi, you are safe, you wouldn't get fibroids? Apart from, you know, getting a baby, as you've said.
Interesting. So hormones, we know that estrogen especially is the one that is responsible for growth of hormone, of these fibroids.
Yeah.
That's why when someone gets to menopause, sometimes you see these fibroids shrinking because the hormone levels have gone down.
Okay.
Now the reason why these women who are not giving birth, the reason why they get fibroids is because of continuous exposure to these hormones. You know, pregnancy disrupts some of these, the cycle of these hormones.
Okay.
So continuous exposure to these hormones are the ones now that contribute to the growth of these fibroids.
Okay.
They thrive on these hormones.
Okay.
That's why now when you reach menopause, the hormones go down, you are now, the fibroids tend to shrink. Yeah.
I see. And now we've talked about the risk factors. So for someone who already knows that they have fibroids, what's the treatment? What's the way forward?
Okay. First, before we go to treatment, there's something you asked whether someone can do anything about it to prevent them. We have the risk. We have the risks that you can do nothing about. For example, age. We know that most of them the fibroids are more common among women who are in the ranges of 30s, 40s.
Okay.
The peak age is about 35. In some communities, others have reported 40 years. So you can do nothing about your age.
Yeah, yeah.
But we have things like a family history, you can't do anything about it. But we have risk factors like BMI that you can do something about.
Okay.
For example, if your BMI is too high, you can lose your weight, have an ideal BMI, and then that might help.
Okay.
Yeah.
Okay.
Yeah.
For the people who have low BMI, are there, is it in any way related?
No, okay, when you have a low BMI, it doesn't, it doesn't help you to prevent the fibroids entirely. For example, you have a low BMI, but you have never given birth. You see that again comes in. Although strictly speaking, we have those ones who get the fibroids, but they don't have some of these risk factors. For example, someone has been giving birth, maybe they have 3 children, then you find they also have fibroids. So it doesn't completely, so someone does not need to have these risk factors for them to develop fibroids. Some of them just develop without some of these things that I've mentioned.
Okay.
However, there are some things that have been shown to protect someone against fibroids. For example, if those ones who are on oral contraceptive pills, there have been some studies have shown that they might be protected a bit against fibroids. And those ones, and those ones who are also, who have many children, they are less likely to get fibroids.
Okay.
So the more children you have, the less likely to have the fibroids. So those are some of the protective factors.
Okay.
Yeah.
Maybe before we even get to treatment, what are some of the symptoms of fibroids? How would you know you have fibroids?
Yeah, so the common symptom of fibroids is usually abnormal bleeding. Abnormal bleeding. So someone has either messed up menses, like they are very heavy, or they come, they are prolonged. For example, ideally, the menses are supposed to be like around 3 to 7 days, and someone starts having menses for like 14 days. Almost bleeding almost continuously. Those are some of the symptoms someone can have. Still, you can have menses for the right number of days, let's say for 4 days, but they're quite heavy. That's another symptom. So abnormal bleeding is usually the commonest symptom, but we have other symptoms. For example, you can have pain, usually in the lower part of your tummy. which we call the pelvis. You can also have pain in the pelvis.
Okay.
You can also have sometimes backache. And then when the fibroids are large enough, sometimes they can compress on the structures that are around them. For example, on the front part, they can compress on the bladder. This is where the urine is stored.
Okay.
So they can compress on that bladder, and you can have symptoms related to urine. For example, you can urinate more frequently, or when you go to urinate, you find that you cannot completely empty your bladder.
Okay.
So those could be some of the symptoms that probably the fibroids are compressing the bladder. But this is when they are so large.
Okay.
And then we have on the back side, we have like the rectum, that is where we have the stool. So if you have fibroids that are large enough, they can also cause some constipation. And then you can also have, depending on the location of the fibroids, you can also have compression of nerves within the pelvis, and they can give you other symptoms, backache and all that.
Okay.
So those are some of the symptoms that someone can have. There has been some weak association between fibroids and infertility. They don't generally cause infertility, but sometimes they can contribute to infertility. For example, if someone has large fibroids that have distorted the uterine cavity, then they are likely to lose a pregnancy, for example. And if, for example, a fibroid is blocking the fallopian tube such a way that the egg or the sperm cannot pass, then the fibroids can also contribute towards fertility. But there has been a very weak link between infertility and fibroids.
Yes. Okay. Now let's talk about treatment,
Yes.
because I know we'll be answering some of the questions, and you've mentioned a very important part, the relationship between fertility and fibroids,
Yes.
which most of the people ask about.
Yes.
But let's talk about treatment.
Yes.
So how is fibroids treated, and is it different for the smaller ones? Meseme kigrow sana, now you'd realize something is happening. Is it different for the larger fibroids and the small ones?
Now, treatment depends on various factors. But generally, we have 3 modes of treatment. We have what we call conservative management. So this one you just observe.
Okay.
You don't do any active treatment. And then we have medical treatment where we use drugs. And then we have surgical treatment where now we perform the surgery. Now, whether to treat or not to treat and the type of treatment depends on various factors.
Okay.
Number 1 is the age of the patient. How old are they?
Okay.
Number 2 is the size of the fibroid. Number 3 is the location of the fibroid. We have the fibroid that are located on the womb, yes, but are on the outer side.
Okay.
We have the ones that are within the muscles and the ones that are growing into the cavity where the baby, where in the womb where the baby is actually carried.
Yeah.
So it depends on where they are.
Okay.
So that location of the fibroid also determines the kind of treatment. Another one is the desire for fertility. So I'll treat you differently. If, for example, you are 50, you don't need any kids, and someone who is 28 and they wish to have kids in future.
Okay.
And then also the desire to just keep the uterus, despite fertility notwithstanding, you just want to have your uterus intact.
Okay.
So that also can influence. Another one is availability of resources and expertise of the doctor who is handling the patient.
Okay.
So those are some of the factors that are considered when you are choosing the mode of treatment.
Okay.
Now, we talked about 3. One is conservative management, where we might not really actively intervene. It's good to remember that majority of the fibroids are not symptomatic.
Okay.
These things are extremely common. The prevalence is reported to be around 16 to 30%. That means 16 to 30% of women actually have it. And in some of the population, the prevalence is as high as 50%.
Okay.
Some research has shown that lifetime risk is about 50 to 70%. That means from the time you are born to the time, let's say, you get to menopause, what are the chances that you might actually have a fibroid? It's as high as 50 to 70%.
That's really high.
But as much as they are very common, it's good to remember that only 20 to 50% have symptoms. The rest don't have any symptoms, but 20 to 50% have symptoms that we mentioned.
Okay.
So especially those ones which don't have any symptoms, we may sometimes just decide to observe. We do nothing about it.
Yeah.
And that's what I was calling conservative management. And then we have these ones that are now causing the symptoms that we mentioned, abnormal bleeding. And bleeding can be very serious to the extent that it can even cause anemia.
Okay.
Yes, among the women. So it can be serious. So those ones who have symptoms are the ones we now treat in most cases. So now the treatment depends on the factors that I mentioned. Medical treatment, we usually give an injection that they say the injection is given either monthly or every 3 months. So that injection is meant to shrink the fibroids.
Okay.
It's documented that the injection will shrink the fibroids by about, let's say, 35 to 65%. Majority of the time we see a shrinkage of about 45 to 50%.
Okay. Which works well?
Which works well
Okay.
to control the symptoms.
Okay.
But there is a downside of it, that when you stop the treatment,
It
they
grows
grow back again in about 4 months.
Uh-huh.
Within 4 months, they grow back again. So
So you
that's
have
the
to be on
downside of medical treatment. No, but you can't be on the treatment forever because the medication, the injection we are giving you every month has side effects. For example, it can cause bone loss, for example. So we can't give you, it's recommended that we only treat you up to 6 months.
Okay.
We can't give the injection for more than 6 months because of the side effect.
Okay.
So for that reason, we don't give injection to everyone, but the people we typically give such injection are the ones who are maybe approaching menopause, so that once they shrink, you get into menopause, then they don't grow.
Okay.
Or those ones that we want to shrink the fibroids in preparation for surgery, for example, so that we make the surgery a little bit easier.
Okay.
Yeah, so short-term interventions.
Okay, okay.
However, they can still be used, but it's good to know, the patient to know that they can grow back in about 4 months. To
And
the,
4 months is a short while.
yeah. You see, what happens is that the injection is going to suppress the hormones upon which the fibroids thrive.
Okay.
So if you suppress the hormone, it means now the fibroids are going to shrink. But when we stop the treatment, of course, hormones come back.
Yeah.
That's why they grow back
Okay.
again.
Okay.
Yeah.
Works well. Now, on the shrinking part, maybe before you continue,
Yes.
is it possible for the fibroids to just shrink on their own, hata kama haujafika menopause?
Yes, yes. Fibroids can actually shrink on their own. Fibroids shrink on their own. Sometimes you have seen large fibroids shrinking, but there are situations in which fibroids typically shrink. One, if someone gets to menopause, because these hormones now go down.
Yeah.
So they will shrink. Another situation we see is pregnancy. So in pregnancy, we see that majority of the fibroids either shrink or remain the same. Very few increase in size. Majority shrink or remain the same.
Okay.
So those situations, fibroids can actually shrink.
Okay. Okay. I see. We'll be going into more treatment,
Yes.
but maybe let's talk first about surgery.
Yes.
Surgery, kwa treatment.
Yes.
Let's talk about surgery because I see we have many questions on surgery.
Yes.
So at what point do you now really need surgery for fibroids?
Yeah, typically we do surgery when someone needs the treatment based on the factors, but most importantly, symptoms.
Okay.
For example, if someone has fibroids and they are bleeding so much to the extent they're getting anemia, that's a candidate for treatment.
Yeah.
And surgery is one of the options, as I mentioned. Now, so if you have fibroids and are causing you symptoms that are interfering with life or other aspects of reproductive health, then now you need treatment.
Okay.
Now, the mode of surgery, there are ways of going about the surgery. So we have surgeries that we just remove the fibroids and leave the uterus intact.
Okay.
And we have surgeries where now we remove the uterus.
Okay.
So we remove we remove the fibroid and leave the uterus intact.
Yeah.
Another one, you come out with everything, even the uterus comes out.
Okay.
But remember the factors we said, like age,
Okay.
desire for fertility. So for example, if you are 52 and you're having this heavy bleeding due to fibroids, you don't need any children at that point.
Yeah.
We could decide to now remove the whole uterus. Remember, the fibroids are growing on the uterus. So when you remove the uterus, you come out with the fibroids as well. So we can do that surgery. It's called hysterectomy.
Okay.
There are ways of going about it. One of the ways is we just cut through your tummy and we get out the uterus.
Okay.
Another way is we call it laparoscopic. Yeah, laparoscopic, total laparoscopic hysterectomy. So this one, we punch some holes on your tummy for us to access the uterus, and then we are able to remove it. Another way of going about it is to go through the birth canal down there.
Okay.
You can actually get the uterus through the birth canal, but when the fibroids are small. When they are large, you are unlikely to succeed through that route. So those are some of the ways in which we remove now the whole uterus. Another way of going about it is to remove the fibroid and leave the uterus intact. That is called myomectomy. Now for myomectomy, again, the routes vary. So one route is to still cut through your tummy, and then we access the abdomen and we remove the fibroid and leave the uterus intact. Another way is again through laparoscopy, laparoscopic myomectomy. We again go through some holes and then we are able to remove the fibroids. Another way, again, we can go through the birth canal, especially those ones in the cavity that are projecting into the cavity. They are not inside, deep in the muscles, and they are not on the outer side. They are deep in, they are hanging in the uterine cavity. So those ones we can go through the birth canal, enter the uterine cavity and remove them. That is called hysteroscopy. So we also have hysteroscopic myomectomy. So those are some of the ways of removing the fibroids and leaving the uterus intact. Especially for people who desire to bear more children.
All right. I see. Now we have some of the some vox pops where people say what they understand about fibroids and maybe ask questions. So we're going to get that and then we're going to be answering them. All right. So we're going to be getting the video where we have people answering some questions about fibroids. Alafu tukirudi, najua daktari atakuwa akisikiza. Alafu tukirudi, he'll be here to answer and just to hear if we are well informed about what is fibroids and some of the issues that surround fibroids. So let's get the vox pops and then we'll be coming back.
Kwa majina naitwa Francis Chege. One of the causes ya uterine fibroids ni obesity.
Majina naitwa Diana. Fibroids huletwa na bacteria sana sana kwa wanawake, and diet, kukula red meat.
Kwa majina naitwa Nancy Wairimo, mkaaji wa Nakuru, na nimeokoka. Kulingana na swali ambalo mmeuliza, I think fibroids zinakuwa caused na hormones ambazo zina abnormal hormones kwa mwili ya that uterine wall.
Kwa majina naitwa Joseph Gikonyo na mimi ni mkaaji wa hapa Nakuru. Na niseme ni asante kwa sababu mmekuja kuulizia ya kwamba ni shida ama ni nini ambacho kina cause the fibroids katika uterus ya wanawake. Mostly kulingana na cases zile ambazo zimeonekana nyingi za fibroids, huwa zinatokana ama zinapatikana kwa wanawake ama kwa wasichana walio na umri kuanzia miaka 25 kuendelea. Kwa sababu maumbile ya mwanamke vile ameumbwa ya kwamba uterus yake inafaa kupokea mtoto akifikisha umri wa kiwango fulani. Kwa hivyo msichana akikawia pasipo kupata mimba ama pasipo kupata ile mbegu, huwa unapata ya kwamba wakati mwingi huwa wanasafa na shida ya fibroids. Na pia mwanamke pia akiwa amezaa kisha pia akawa amekata na miaka zingine mingi, anaweza jipata kwamba anapata ile shida ya fibroids, ama wakati mwingine akajipata kwamba hata kupata mtoto inakuwa ni shida.
Kwa majina naitwa Virginia Mombi Ng'ang'a, na kwa maoni yangu na mafikira zangu, fibroids huwa zinapata mtu kwa ajili ya kukaa muda mrefu kulingana na maumbile ya Mwenyezi Mungu. uterus ya mama ni kama imeumbwa kushikilia kitu ama to hold something. So inapokaa kwa muda mrefu bila chochote, yenyewe inajitafutia, inatafuta kitu cha hold, and that's why tunapata hizo fibroids. Pengine kunaweza kuwa kuna sababu zingine, lakini sana ile inasababisha ni ile uterus kukaa bila chochote cha hold, na tunapata hizo fibroids ambao husababisha a lot of bleeding, na eventually tunaona kwa kina mama wengi inaishia kufanywa operation na kutolewa ile uterus nzima.
Well. Kuna watu hapo nimeona they're doing very well. They've mentioned what you've just said here. That's really good information. But then I have a question.
Yes.
Kuna mwenye mentioned about diet and taking red meat.
Yes.
Unataka kutupia pressure. Tell us about red meat. Kuna watu wanakula nyama sana. Tell us about red meat.
Well,
is it a risk factor?
Consuming red meat has not been associated with fibroids. Other factors notwithstanding. Let's say you take people who take red meat, others who don't. Then you look at whether the ones who are taking red meat have more fibroids than the others. We have not had such a study to prove that red meat alone can cause. But obviously, diet contributes to some of these things that we are talking about, like BMI.
Yeah.
That can put you at risk of fibroids. Now, whatever we are saying, like high BMI, not giving birth and stuff like that, these we mention them as risk factors for fibroids, not necessarily causes.
Yeah.
But they're just putting you at risk.
Okay.
Not that they're causing.
Okay.
Another person mentioned that when they have abnormal hormones, that's when they have fibroids. Really, no. The hormones, when we look at your hormones, when we find you with fibroids and we test your hormones, let's say estrogen, it's likely to be normal.
Yeah.
It is this exposure to it for some time that causes, not that the levels of estrogen are abnormal.
Okay.
The levels of hormones are actually normal.
Okay.
Just wanted to make that clarification as well.
All right. So it's not that you'll be treating hormonal imbalance. It's that your hormones are okay.
The hormones are usually okay.
Okay. I see,
The hormones are usually okay.
I know some people would maybe try to now go check if their hormones are okay. There's one time we had this discussion on hormonal imbalance.
Yes.
Not only kwa kiuliza, hiyo ndio inacause fibroids, so it's good that you've answered that.
Yes.
I see we're almost taking a break. We only have 4 minutes, but maybe that would be enough for us to answer this question. What is the difference between fibroids and cysts?
Oh, they're different. I suppose they mean ovarian cyst.
Ovarian cysts.
Yeah, so fibroids, as we say, it is a growth on the uterus itself, arising from the muscles of the uterus. Whereas cyst is a fluid-filled lesion that is on the ovary.
Okay.
It's something like some membrane with some fluid inside. That's what we are calling a cyst.
Okay.
So they are different. So the cyst is on the ovary. It has fluid inside. But the ovary, but the fibroid is actually a mass, like a solid tissue on the muscles of the fibroid, of the uterus.
Of the uterus, and you said it's not cancerous.
It's not cancerous.
Let me ask. I know we're not talking about cysts today.
Yes.
But you say it's a sac that has fluid.
Yes.
Inakosiwa na nini? Hii fluid inatoka wapi?
Well, that's a whole
discussion.
Maybe we can have it another time.
Yeah.
About causes of the cyst, the type of cyst. And remember, cysts can also be cancerous.
Oh, really?
Yes,
okay.
You have cysts that can also potentially be cancerous. So maybe that's a whole discussion. We can have it another time.
Yeah.
But it's also good to mention this at this stage that as much as we are saying fibroids are not cancerous, indeed they are not cancerous. However, the risk of cancer for a person who has fibroids, they're called leiomyomas or myomas in other medical terms. But when you now have cancer that arise from the muscles of the uterus, where the fibroids come from, it is now called a leiomyosarcoma. Now, the risk of such a cancer for someone who has fibroid is very low, 0.1 to 0.5%. Yeah, so that's why you generally say fibroids are not cancerous.
Not cancerous.
Yes.
I see. I see. Okay. Now, we'll be talking about cyst on another sitting, and maybe is it possible for us to combine cyst and PCOS? Because
Yes. We can handle that topic that day.
Okay.
Yes.
So we'll have another sitting as we talk about the both of them. But for now, today we're talking about fibroids, and we've been able to quite explain what are fibroids and the causes and all that. If you have any question, our numbers are still very open. That is 0721 105 105 on WhatsApp, 23814, our SMS code, which is absolutely free of charge. Oh, and by the way, on our WhatsApp number, you can still SMS. We'll get your message loud and clear. But please, don't call, text. Tutapata ujumbe wako, we promise. All right, and of course, live on Facebook on MBCI TV, Facebook page, live on YouTube on MBCI TV official YouTube page. This is Afya Clinic, where we talk about everything health, where we say that your health is very, very important. Your host today is Rachel Kahugo. We're taking a very short break. As we come back, we'll be coming back to read your feedbacks and answer your questions. Today, we're talking about fibroids with Dr. Wekesa. Usiende mbali.
MBCI Television, transforming lives.
Unleash your creativity and style at Goshen Medical and Technical College School of Cosmetology and Fashion Design. Our school offers a wide range of programs that cater to your unique talents and interests, whether it's hairdressing and beauty therapy, nail technology, trainer of trainers, garment making technology, interior design, soft finishing, or basic tailoring. We've got a program that suits your creative ambitions. Our programs are accredited by renowned examination bodies like NEC and NITA. We offer certificate, diploma, and a variety of other qualifications.
A minimum of grade C or higher is required for diploma courses, D plain or higher for certificate courses, and D and below for artisan courses.
For more information, visit our campus or call us at 0750 264 044 or 0723 047 468. You can also check out our website at www.goshencollege.ac.ke.
Welcome to Goshen Medical and Technical College, Thika. Yay!
Wiki hii tumeangazia hili.
Kule kuogopa kufanya maamuzi fulani ama chaguo fulani katika maisha yako inaweza kuwa njia ya kunyima watu baraka.
Naogopa bana, niingie katika ndoa alafu ndoa yangu yanguke, nifungue hii biashara alafu yanguke. Niende shuleni alafu nikose kupita ule mtihani.
Wiki ijayo tutazungumzia urejesho. Je, ni nani atajumuika na kikosi chetu kujadilia hili? Usikose kutizama Biblia na Maisha. Mungu ni wa urejesho.
MBCI Television, transforming lives.
All right, we are back after that very short break. Karibuni sana if you're just joining us. This is MBCI TV ambapo tunabadilisha maisha by the grace of God. And of course, the show on air is the one and only Afya Clinic that comes to you every Wednesday from 7:35 a.m. up to 10 a.m. It's such an amazing show where we talk about everything health. And today we're talking about fibroids. We're here with Dr. Wekesa. Na sasa tumerudi so that we'd be able to go through some of the questions ambazo muuliza, and then we'll be getting to answer them. I'll start with huyu hapa ambaye anasema, hi MBCI, I would like to request doc to explain the difference between fibroids, ovarian syndrome and endometriosis, please. Hizo ni tatu. Hizo ni tatu, and they're
okay.
all very wide, but let's go.
Okay. Yeah. So as we said, fibroids now we know them. We said that growths arising from the muscles of the uterus, and they are not cancer.
Yeah.
The other question she was asking is, was it polycystic ovarian syndrome?
Yeah.
Polycystic ovarian syndrome is a situation where you have small cysts, less than 1 centimeter. We already talked about what cysts are. Now you have very small ones, less than 1 centimeter, and many of them, usually more than 10 in each ovary.
Okay.
And then these are associated with derangement in hormones.
Is that PCOS?
Yes.
Okay.
So that now becomes polycystic ovarian syndrome. And then the other thing she asked about endometriosis.
Yeah.
Now endometriosis, first of all, let's talk about the uterus for us to understand endometriosis. So the uterus has 3 layers. The outer part, the middle part, which is the muscles, and the inner part, which is endometrium, which we call endometrium.
Okay.
That is the lining of the uterus where even periods actually come from. That is the one that is usually shed during menses. So when you have, so that endometrium is supposed to be located in the, it's supposed to line the cavity of the uterus. But when by some chance or through various mechanisms is located somewhere else, let's say on the ovary or somewhere in the abdomen, so that is what we call endometriosis. When the lining of the uterus we are calling endometrium is located elsewhere other than the lining of the uterus.
Okay.
And it can be anywhere. It can be in the abdomen, it can be even sometimes in the lungs, it can be anywhere. That's what we call endometriosis. Yes, yes.
And I know that would bring a whole other discussion.
Yes, sure.
But maybe in a scale of 0 to 10, how treatable is that endometriosis?
Yeah, endometriosis is treatable.
Very
we have
treatable.
treatment for it.
Okay, okay, perfect. Anasema, good morning. This month, I lost a 9 weeks pregnancy. During scanning, it was noted I have multiple fibroids, the largest being 7 centimeters. The doctor suggested the fibroids could have been the cause. I'm at 7 years with one child who's 14 years. Please help, I need children.
Yes, so we have, fibroids can actually affect pregnancy. Yeah. So if you conceive and you have fibroids, some of the effects that can have it, especially in the first trimester, you can actually lose a pregnancy. You can have a miscarriage, and probably that is what happened.
Yeah.
It's not, it may be hard to pinpoint and say it's only the fibroids that contributed to the loss, pregnancy loss. Maybe she had other things, but fibroids is one of those things that can cause a pregnancy loss at that point.
Yeah.
We have other effects. Of fibroids in pregnancy. For example, they can also cause pain during pregnancy. They can also cause pregnancy complications. For example, they can cause abnormal location of the placenta within the womb.
Okay.
They can also cause the lie of the baby to change, so that instead of the baby coming down with the head, they can come with the, let's say, buttocks.
Okay.
They can also cause dysfunctional labor and many other things. So they can actually affect, they have some effects in pregnancy.
Okay.
They can also cause premature labor and all that. And after delivery, sometimes they contribute to heavy bleeding after delivery, whatever we call postpartum hemorrhage. So yes, fibroids can affect pregnancy. Now, whatever the doctor told her that she needs to get treated before she gets another baby, that will be important. Generally, if we find fibroids and we have not demonstrated that they have affected your pregnancy, there is no compelling indication that we have to treat them for you to conceive.
Yeah.
However, if you have a history that fibroids have already affected your pregnancy, that's a patient whom we need now to treat the fibroids before she gets pregnant again.
Okay.
Yes.
So what happens if a patient realizes that they're pregnant but they have fibroids already? Or rather, they realize they have fibroids when they're already pregnant. So what happens?
I will just continue with the pregnancy. The treatments I talked about, like myomectomy and all that, they are not recommended in pregnancy, unless in very special circumstances. But generally, conservative management is what we recommend in pregnancy. We will not actively treat the fibroids in pregnancy. So we just carry the pregnancy to term. In case of any complications arising from that, that's what we deal with.
Okay.
Yeah.
Is there a way of shrinking the fibroids when one is already pregnant?
No, we don't give medication to shrink the fibroids when someone is pregnant. That medication is not recommended in pregnancy. However, pregnancy itself might make the fibroids shrink or stabilize, not to grow bigger. In very few circumstances, they can grow bigger, but in most cases, they actually shrink. Yeah.
Perfect. And I said, I have a doctor who recently finished high school and she has been having problems with her menses. She experienced pain below the abdomen and long periods for about a month and mostly more than a week. And I said, she has been under medication but no results. What could be the problem?
The problem is likely to be something else rather than the fibroid. So that girl is supposed to be checked so that we find out what is causing her prolonged periods and sort it out. But chances are not fibroids. Yeah.
So she needs to get checked.
She needs to get checked.
Okay.
Yeah.
I see. Now there's a very interesting question here. And I said, does castor oil helps in shrinking fibroids?
Not proven.
Not proven.
We don't have evidence that castor oil will shrink fibroids.
Okay. Yes. So just go to hospital and get checked.
Yes.
That's very important. Don't self-medicate.
Yes.
All right. And can fibroids be transmitted from one person to another? How?
No.
Surely. But you've said family history?
Yes. Yeah, but not transmission.
Okay.
Yeah.
But you've said if someone has a family history, if in your family there's someone who has fibroids.
Like your mother, sisters, then you have a slightly increased chance of having fibroids.
Okay. Okay.
Yes.
I see.
Compared to those ones without such history.
Okay.
Yeah.
Perfect. Now, let's get some of the myth busters that surround fibroids, just to see what we can tackle there, because as you've seen, mambo ya castor oil, there's so much myths surrounding fibroids and we need to clear them today. So pia kama uko pale and you know some of the myths that surround fibroids, please send in. Our numbers are very, very open. We'd be able to get them and answer them. So the first one that we have on the Mythbusters today is that uterine fibroids are always cancerous. Surely, that's a myth. You've told us about it?
Yeah, they are not cancerous.
Yeah.
Fibroids are not cancerous.
At all?
They're not cancerous.
Okay.
Once you have something else that is cancer, then that's not even fibroid at all. So fibroids are not cancerous.
Okay.
Yeah.
I see. The second one, the second mythbuster is that you can't get pregnant if you have fibroids.
Again, that's a myth. People with fibroids do get pregnant.
Yeah.
Yes.
And carry it to full time.
And carry full time. Majority of them carry to full time without any complications.
Okay.
So that's a myth.
That's a myth.
Yes.
Okay. And the third one is that only women over 40 get fibroids. Again,
no. Fibroids, we said they can occur anywhere within the reproductive age. And we just said that the peak incidence, the age group where we see a lot of fibroids is in the 30s and 40s. But it can occur even in the 20s. You find even 50-year-old with fibroids, which obviously they started a bit earlier.
Okay.
So fibroids can occur in those age ranges, but not only above 40. We even find young women in 20s that have fibroids.
Yeah.
Yeah.
Okay. So the last one there is an absolute myth. Okay. Now, we have a question here, and I say, I have been receiving my periods heavily since I was young. I'm now 30 years and still come heavily. I say, am I okay or am I sick?
Yeah, if she has consistently had heavy menstrual periods, there's a problem. So she needs to seek treatment. Okay. Fibroids could just be one of the reason why she has, but there are many other reasons why someone can have heavy periods. The best thing is to have her checked.
Okay. Okay. Anasema, hello MBCI, I'm one of the viewers. Please can I get your number for treatment? Okay, we'll be giving the numbers later as we wind up, so that if you're there and you need to get checked, you can always call, and we'll also give the location.
Yes,
that's possible.
Yes,
so that they'd be able to get treatment as well. Anasema, good morning. Anasema, anasema, so swali yangu ni hii. Niko na discharge kutoka 2020 akiwa pregnant, and every time akienda hosi anaambiwa ni infection, haijaisha mpaka leo. Could it be fibroids?
No, chances are they are not fibroids. They rarely cause such bothersome discharge. Maybe she has something else she needs to get checked.
Okay. Sema, good morning MBCI. Amwini kutoka Mombasa. Anasema the weather here is too hot. All right, tulikuwa tuuliza, here it's raining. It's not very heavily, but we thank the Lord for the rains. Anasema, I have 3 questions about fibroids. 1, what are the causes of fibroids? I'm sure that you've answered, but maybe you can just tell her.
Yes, we have answered. Yeah, we have answered that fibroids thrive on hormones, especially estrogen. Yeah, that's why they occur in the reproductive age group.
Yeah.
But also we talked about risk factors that put someone at risk of fibroids.
Yeah.
Like nulliparity, that is someone who has not given birth.
Okay.
Yes.
Okay. And can fibroids be prevented?
Yeah, again, we answered that.
Yeah.
We said that there are some risk factors that you can do nothing about it, like your age and all that. But however, we said there are some things you can do something about, like handling your BMI, if it's the one putting you at risk of fibroids.
Okay.
Yes.
Okay. Anasema, good morning. Is periods with big clots associated to fibroids, and how can it be controlled?
Yes, heavy periods are associated with fibroids. So that's one of the commonest symptoms of fibroids.
Yeah.
So controlling the bleeding, if you have fibroids and you have heavy bleeding, controlling the bleeding simply means treatment of the fibroids, because that's what is underlying. So the treatment modalities that we talked about are the ones we actually employ to control the symptoms. However, there are other things that we didn't mention in the course of treatment, because people specifically wanted to know about surgery. But we have other things, like if someone is having heavy periods, sometimes we can, as a short-term measure, we can use some pills to control her bleeding as we plan for definitive treatment to sort out the fibroids. Another way of going about it is sometimes there is a special intrauterine device, whatever people call coil. There's a special coil that has some hormones that we usually insert. As much as it's used for family planning, it also controls bleeding in some patients who have fibroids. But also there are other treatment modalities apart from surgery that we talked about and the drugs. We have others, like we can go and block the blood vessel, the artery that supply fibroids.
Okay.
Yeah, we have an artery that supplies with blood. So if we block that artery, it means we are denying the fibroids the blood that will help it to grow. So that also helps to shrink the fibroids and ultimately control the symptoms. But technology has also moved. We can use ultrasound waves to actually treat fibroids.
Oh, really?
Yeah, we can use focused ultrasound waves to actually treat the fibroids. Yeah, so technology keeps on moving.
Yeah, for sure. Yes. Now, what you've talked about closing the artery that supplies blood to the fibroid, does that have any side effects?
Yes, it has some side effect. When we do that, that procedure is associated with poor pregnancy outcomes. So if you want to get children, you are not a very good candidate for that, because it's associated with poor pregnancy outcomes. Abortion of in the range of 60% once we have that procedure done on you. So if you still want to bear children, maybe you're not a good candidate for that.
Now, are there any foods or lifestyle habits that you would recommend for the ladies that would help with making sure they are not at risk of getting fibroids?
That's an interesting question.
Yeah.
Because if you look at one of the risks that we talked about, like nulliparity as a risk factor for fibroids, someone who has never given birth. So now the question is, are you compelled to give birth to prevent fibroids? Maybe
surely.
not. Yeah, surely. Maybe you have decided in your life you don't want children or you just want one.
Yeah.
So I don't know whether you are now compelled to give birth just to prevent fibroids. Perhaps not.
Yeah.
But as we said, things like BMI, you can do something about.
For sure.
Yeah.
For sure. So it is more of staying healthy.
Just stay healthy.
Yeah.
Eat a healthy diet, maintain a healthy BMI, and you can put off some of these, not just fibroids, but some of these lifestyle diseases.
Okay, okay. Well, I see we still have questions coming in. So if you have a question, you can always send it through our numbers, 0721105105 on WhatsApp and normal SMS. Okay, and then on our SMS code, which is 23814, absolutely free, we'll be able to get your feedback. And of course, on the other side, we're live on Facebook, on MBCI TV Facebook page, and on YouTube on MBCI TV official YouTube page. And I say, hi, Daktari, my name is Nyuki, 47 years old. I was diagnosed with fibroids 2 years ago. 1, can fibroids go away with menopause? Do you want me to join? Okay.
Yes, we said the fibroids can actually shrink during when someone gets to menopause. They can shrink.
Okay.
And symptoms do improve when someone gets into menopause sometimes.
Yeah. And I said, how can it be killed without surgery?
Yes, we talked about now the ways of treating fibroids without surgery. If we can just go through them, some of them. 1, we said you can give medication.
Yeah,
we talked about injection that can shrink the fibroids. 2, we talked about blocking the artery, which we call uterine artery embolization, where we block the vessel that supplies the uterus, where the fibroids are.
Yeah.
Another way of avoiding surgery is using focused ultrasound.
Yeah.
MRI guided focused ultrasound. So you can treat the fibroids using that. So you don't always have to go for surgery.
Okay.
Yes.
Okay. And 3. Question 3 on the same, and the advice on diet and lifestyle to go about with it. Now for this one specifically, and would you advise on diet and lifestyles to go about with it?
For fibroids.
Yeah, she's 47, diagnosed with fibroids 2 years ago. So from she was 45. So she's asking, is there any diet and lifestyle?
There are really no specific things in the diet you can say, maybe eat a banana to cure fibroids.
Yeah.
There are no such things.
Okay.
But you're just advised to eat a healthy diet that will maintain your general health.
Okay.
And you are maintaining your normal BMI. That will be very, very essential. But there are no specific maybe type of food that we can advise and say, take this thing is a sure bullet to the fibroids. No, we don't have such a thing.
Okay, I see. And if I was pregnant each time I go to give birth, okay, I think you're saying every time you are pregnant and you're going to give birth, it was a cesarean delivery due to fibroids. How can it be controlled? And it will be Linda kutoka Assemble.
Well, if there are fibroids, we said the fibroids can cause some pregnancy complication that can increase the chances of someone delivering through CS.
Yeah.
However, majority of women with fibroids deliver without going through the CS. They just deliver through the normal route.
Yeah.
It's a few whom the fibroids will complicate their pregnancy and put them at risk of delivering through cesarean section. For example, we said they can cause malpositioning of the baby. They can also cause dysfunctional labor. And sometimes when they are on the lower part, especially at the cervix, they can block the passage of the baby. They can obstruct the baby from coming down and going through the birth canal. So those ones can also cause someone to have a CS.
Okay.
but majority of women can actually deliver without going through the CS. They can just deliver normal even when they have fibroids.
Yeah.
Now, I might not be sure the reason why this lady actually went through the CS, what complications she had arising from the fibroids that made her go through the CS.
Yeah.
But as we said, if you get a pregnancy complication and from the fibroids, it's always good to sort the fibroids out before you conceive again.
Yeah, which is very, very important.
Yeah.
Okay, I see. We will be going through the questions, so bado tuendelea kuzipata, but for now, I'd want for us to get the healthy living segment. So on this segment, we'll be seeing what Sylvia Wanja is telling us about living healthy. We say that on this show, we talk about everything health. So it's very wholesome. Sawa sawa. So we're getting this segment by Sylvia Wanja, where we get to see what exactly are we supposed to do to keep living healthy. This is Healthy Living. Usiende mbali.
Hello and welcome to Healthy Living. My name is Sylvia Wanja. Today we are going to discuss all about uterine fibroids. Uterine fibroids are non-cancerous growths in the uterus, and while their exact cause is unclear, certain lifestyle choices and health habits may help reduce the risk of developing them. Here are tips for uterine fibroid prevention. Number 1, maintain a healthy weight. Obesity is linked to an increased risk of fibroids due to higher levels of estrogen production. Engage in regular physical activity and eat a balanced diet to manage a healthy weight. Number 2, adopt a balanced diet. Increase fruits and vegetables. Eat foods rich in antioxidants such as leafy greens, berries, and citrus fruits to reduce inflammation and oxidative stress. Consume whole grains. Foods like oats, quinoa, and brown rice can promote hormonal balance. Limit red meat. High consumption of red meat has been linked to an increased risk of fibroids. Opt for lean proteins like fish, poultry, and legumes. Reduce high fat and processed foods. Avoid trans fats and processed snacks that may contribute to inflammation. Number 3, manage estrogen levels. High levels of estrogen are associated with fibroid growth. Avoid hormone disrupting chemicals in plastics, pesticides, and personal care products by choosing organic options and BPA-free containers. Number 4, stay physically active. Regular exercise can help regulate hormones and reduce the risk of fibroid growth. Aim for at least 30 minutes of moderate activity such as brisk walking, cycling, or swimming most days of the week. Number 5, balance hormones naturally. Avoid excessive use of hormonal birth control if not necessary, as it may influence estrogen levels. Manage stress effectively, as high cortisol levels can disrupt hormonal balance, and practice relaxation techniques like yoga or meditation.
Perfect. So that is it about healthy living. Thank you so much, Sylvia Wanja. Now we are back, but tuendelee na this amazing, intriguing topic, fibroids, and we're talking about this with Dr. Wekesa, and we're getting to go through some of the questions ambazo mmetuma and just to answer them. Okay? Anasema, hello, my daughter is 14 years old na hajapata the monthly period. Is it normal?
14 years is still young. We consider someone who has not gotten their periods by the age of 16 to be abnormal. So 14, we don't still yet consider it abnormal. Okay. Usually we want to consider as delayed when it is 16 years and above.
Okay.
Yes.
All right. Anasema, good morning. My name is Justus. What are the risk factors associated with fibroids? We've talked about this, but maybe just mention it.
Yeah, we have talked about them. We said if you stay for long without ever giving birth. We talked about a family history.
Yeah.
We talked about high BMI. But there are minor risk factors. For example, it is known that like people who have done studies, let's say in the US, they were comparing, let's say, blacks and whites.
Yeah.
So they noticed that it is more common among blacks than the whites.
Yeah.
We also have so we also have such things like a race. becoming an influence on some of these things.
Okay. Okay.
Yes,
But that's
a risk.
minor.
But that's a minor.
Yeah.
That's a minor. And then another thing that has also been shown is that if you get your menstrual period, you start your menses early. For example, if your first menstrual period is before the age of 11, you are at an increased risk of getting fibroids than someone who starts after 11.
Okay.
So again, those are minor risk factors.
Okay. I see. Anasema, good morning. My name is Maria. I'm 28 years old. I don't have a baby yet. Doctor said that one of the causes of fibroids is staying for long without having a baby. Do I have to compromise for me to stay safe?
But again, we said, giving birth is something, it's a major decision in life. You can't just decide to give birth to keep off fibroids.
True.
There are more serious issues to consider before you actually decide you want a baby, not just fibroids.
True.
Yeah, so there are more serious considerations to someone making a decision to get a baby.
Okay.
Yeah.
Then you also say that that's just one of the risk factors.
Yeah, just
it's
one.
It's not that it's the major.
And it doesn't mean that when you give birth, now you won't get fibroids. You can still give birth and get fibroids.
Correct.
We have so many women who we get, who have fibroids and they have given birth.
Yeah.
Okay. So it's not protective entirely. Like now, it's bulletproof. No.
Okay. Anasema, is it advisable to use herbal medicine to cure fibroids? Anaitwa Ben kutoka Rongai. Which are these herbal? Let's even start from there. What's a mchezo?
Yeah, so we have a lot of herbal medication around that are claimed to actually treat the fibroids. The only problem we usually have, you see, as scientists and medical practitioners, we always want to give a treatment that is evidence-based, something that has been shown to work.
Yeah.
Some research has been done around it, and we are sure it will work. So the problem with herbal medication sometimes that, first of all, we might not know the content of what is in that herbal medication and whether that content is proven to work in terms of treating fibroids.
Yeah.
So because of those, we generally don't give the herbal medications that are not proven to work. For us, we practice what we call evidence-based medicine.
True.
What has been shown, where we have evidence that it will work.
Yeah.
So that's the challenge we face with herbal medication.
So it's better for them to just avoid since it's not really certified.
Yeah, something that is not scientifically proven to work.
Yeah.
There is also some harm that it can also come with it. So I can't really confirm something that is not scientifically proven.
True.
So for us, we want something where we have evidence that it will work.
Okay. Okay, I see. Anasema, I have been receiving my periods on different dates. Yani haifuatani na the correct date. Inarukaruka sana. Sema, what is the problem? Will it be fibroids?
Unlikely. It could be something else.
Yeah.
Maybe something underlying that is messing up her hormones or something. But it's unlikely to be fibroids. Fibroids, we said, you have regular periods but heavy.
Okay.
Or you have your periods that are prolonged. You bleed for longer than usual.
Okay.
But sometimes you can have bleeding in between periods.
Okay.
Normal or regular periods. But the commonest one is heavy periods or prolonged periods.
All right. Now, what would be the advice you'd give to women who are already having the fibroid symptoms? And at what point do they now need to seek treatment?
Yeah, the moment you have symptoms, you need to seek treatment. Don't wait for complications. For example, if you're having abnormal bleeding, seek treatment before you get anemia, for example. So the moment you have fibroids and you're getting symptoms that we mentioned out of it, just seek treatment at that point. Don't wait for complications.
Okay. Okay. So, you've mentioned about abnormal bleeding causing anemia. What would be the other issues that cause abnormal bleeding? Does that mean that anyone who's having excessive or abnormal bleeding ni fibroids?
No. There are other causes of abnormal bleeding, and it ranges from something subtle to something very serious. For example, it could be even a sign of cancer, for example. When you have cancer of the endometrium, the lining of the uterus that we talked about, you also have abnormal bleeding. When you have cervical cancer, you can have abnormal bleeding.
Okay.
When you have messed up hormones, even thyroid hormone, when it's messed up, you still have abnormal bleeding.
Yeah.
So there are many other things that can cause abnormal bleeding. Fibroids is just one of them. It's the commonest tumor in the pelvis, and is one of the common causes of abnormal bleeding. However, there are so many other things that can cause. So what we usually encourage patients to do when you have abnormal bleeding or abnormal periods, you need to go for evaluation to find out why. Fibroids is just one of the many things that cause abnormal bleeding. Yes.
So hizi kwa tu ni moja no sha decide.
Usidecide in fibroids, no. Come for checkup because there are many other things. So as the doctors will find out. So when you come, we don't usually say you have fibroids. When you come with abnormal bleeding, the question we ask ourselves is what is causing it. So we are going to look for the cause. So perhaps fibroids is just one of them, but there are so many other causes.
I see we have very many questions coming in. We might not be able to answer all the questions, but I know we're going to give a direction of if you are having some doubts about your health, it's always very important for you to go and seek help. We said it is very wrong for you to self-medicate. Hata kama wewe ni daktari, please don't self-medicate. Go get checked. It's very, very, very important. Sawa. But then we can read like 2 questions. We can answer 2 more questions, and then we'll be winding up at that. Anasema, good morning. Naumwa sana during my periods. Is it okay? I'm 31 years old. Could it be fibroids?
Yeah, it could be. Fibroids is one of the causes, but there are more commoner causes of painful periods, which we call dysmenorrhea. So even the endometriosis that someone mentioned is one of the common causes of painful periods. Yes, so it's not always fibroids. Again, it's someone who needs to be checked to find out why is he having painful periods. It's not always fibroid. Fibroid accounts for a small proportion. There are other causes of painful periods. Like endometriosis, for example.
I see. Anasema, anasema, good morning. Naumwa sana during my periods. I think you had answered that. If you're having very painful periods, what could be the problem? And I see many people are relating fibroids to painful or something periods. Is there a very serious relation there?
It's just a symptom, but painful periods. In fact, fibroids might cause. Sometimes fibroids cannot coexist with other conditions. For example, if you have the lining of the uterus that we call endometrium, when it gets into the muscles, abnormally located in the muscles, that's what we call adenomyosis. Those people also get painful periods. So there are many other causes of painful periods. The thing is, fibroids is not the only one. So whenever you have such, just get checked to find out if there are other things. Because chances are there could be other things causing painful periods.
I see. Now, I know you have been answered, but for all the other questions, we'll now be directing them to this specific place where we're going. I will be giving directions for you who you're seated there and you know that you are having something abnormal going on. And you say that tumeachana na mambo ya self-medication, tumeachana na mambo ya, is it castor oil that ilikuwa boliza, tumeachana na mambo ya herbal. So we've decided we need to go get checked. So we'll be giving a direction from there. But maybe, Doc, what would be your parting shot on what we've talked about today in terms of fibroids?
So my parting shot will be that if you have these symptoms that we have mentioned, you're having pains, you're having heavy menstrual periods, prolonged menstrual periods, you are within the reproductive age group, go and get checked. It could be fibroids, it could be other things causing those symptoms, so that we are able to make a diagnosis early and get you treated before you get complications. And another thing is that fibroids are not cancer. So whenever the doctor tells you have fibroids, don't start getting scared. Like maybe there is something like cancer going on. A lot of patients get scared at that point when you tell them they have fibroids. Just know that fibroids are not cancer. So when the doctor tells you have fibroids, it doesn't mean you have cancer.
And you've said it's very treatable?
It is very treatable. We have talked about modalities of treatment, and it's not always surgery. There are other ways of treating it. So if you don't want surgery, we have other modes of treatment.
Okay.
Yes.
Maybe talk a bit about the type of fibroids that really don't show symptoms. Someone probably even living with them na haujui. And then after some time, you realize, niko na fibroids. Maybe during some other scan. Is that supposed to cause any alarm?
Yeah, so as we said, only 20 to 50% of patients with fibroids do have symptoms. The others don't have anything. We discover them incidentally when we are doing imaging for other reasons. For example, you can come for your first trimester ultrasound scan, and then as we do the ultrasound, we notice, this lady has a fibroid, but we didn't have any symptoms. Or you come for any other reason, then during the imaging, we are able to now pick them. So the fibroids that really cause symptoms, let's say bleeding, are the ones that are located within the cavity of the uterus. So are the ones that are mostly symptomatic. Remember, we said they could be projecting into the cavity of the uterus, or they are within the muscles, or they're outside. The ones outside, hanging outside the uterus, they rarely cause symptoms unless they twist, and that's when they get a lot of symptoms. But usually they don't have symptoms. But the ones within the cavity are the ones that mostly cause this abnormal bleeding. So those are the ones that are mostly symptomatic. So the ones outside might not be symptomatic.
Okay, I see. So that has been it about the topic of discussion that we've been having today about fibroids, which has been really eye-opening. So if you're there and you've asked the question at Mejibu, but and you feel like you need more intervention or you need to see a doctor, we are having Dr. Wekesa here today, and maybe Dr. this is where you tell us for anyone who's there na naona lazima apige simu ama akuje hospitalini aangaliwe. What's the way forward?
So if you want to come for consultation, for any gynecological problem, not just fibroids alone. Our office is at Jennifer Area Hub in Nakuru town, which is on Tomboya Street, at the junction of Tomboya Street and Kipchoge Avenue, near Bontana Hotel. That's where we are located. We are on 5th floor in the name of Preston Healthcare Limited. That's where we are. For the number, you can call 07 91 99 10 22. 07 91 99 10 22. So you can reach us through that number. Yes.
I know we'll be having the number on the screens in a very short while. That's it. So the number is there. If you need to call, please make sure that you reach out. Your health is very, very, very important. Maybe just repeat where you are located.
Yeah, we are located at Jennifer Area Hub on 5th floor. That's on Tomboya Street, Nakuru town. Yes.
Perfect. Now for all the questions that you've had today and you've not been able to answer, you have the number. So you can call, you can make sure, call or text.
Yes, they can also text. Yes, they can also WhatsApp.
You can WhatsApp, any of that, and then you will get help. We say that your health is very, very important. On this show, tunasemanga, Mungu akikusaidia ukwe na masomo vizuri, ukwe na pesa vizuri, all that we are praying for, and then your health then becomes a problem, you won't be able to enjoy all these. That's why we talk highly about health. And we're praying that God will grant us good health, sisi sote. All right? And that is why we have doctors on board who help us with just making sure that tuko sawa. So make sure you go visit, go get checked, make sure you call, because that's very important. So that has been it on today's show. We've been talking about fibroids. We've had, Doc, is it fibroids or is it fibroids? Kwa sababu nimekuwa nikizita tu vile. Is it fibroids or fibroids? Ama ni zote?
It depends on your primary school teacher. Primary.
Yeah, okay. Now you see. Yes. Depends kama ilikuwa ni group of schools ama polling station, but leo tutazita tu zote. So today we've been talking about fibroids or fibroids, and we've been here with Dr. Emmanuel Wekesa, and we've had such a an informative session, and I know that you've gotten something from that as well. Thank you so much for tuning in. We do value your time highly. Thank you so much. You wouldn't have done this if you weren't seated there watching us or, you know, working around as you listen in. So thank you so much. We do value your time. We say that MBCI is a family. Afya Clinic is a family. Okay, now we are getting Did You Know. Of course, unajua ukiona Did You Know, tunamaliza kipindi ya leo, which has been very informative. Tumetengenezewa Did You Know na the one and only Mato, yani Martin, and this particular Did You Know segment inakuanga ya kujoga wa minds kidogo so that you would go and do some more research. Did you know the only part of the body that has no blood supply is the cornea? Yes, that part in your eye. And that, niliona, that is what helps with directing light into your eye or something. I don't want to give wrong information, but that is it. But then I'm wondering, our hair and our nails, they do have blood supply? I don't know. Please go research. Did you know that? Did you know that the only part of your body that has no blood supply is the cornea? Did you? Please go do more research. Alafu utatuambia through our numbers. Okay, so that has been it for today's show. Thank you so much for tuning in. Thank you so much to everyone who made this show a success. Right from the director, from the programming desk, from to the camera, our camera people today. Mungu awabariki sana. Thank you so much to our guest, and of course the whole MBCI fraternity, and you as our viewer, who is a very important part of our family. Thank you so much for tuning in. This has been amazing. We'll see you next week on Wednesday as we'll be having another amazing topic. So if you have any topic that you would want us to talk about, our WhatsApp number is open for that. That is 0721105105. Please feel free, tell us, and we'll be getting a professional doctor who will be handling that particular topic. Others, God bless you. God be with you. Enjoy the rest of your viewing. This has been Afya Clinic, and your host today has been Rachel Kahugo. Enjoy the rest of your viewing. We'll see you when we do on Friday. Yes, so don't miss out. Bye-bye.